Hello, everyone, and welcome to the Rotary Club of Fort Worth. We're glad to have you here. And those of you who are still in the buffet line, if you could keep the noise to a minimum, we'd appreciate it as you get your food out of the buffet line. I'm looking back there because I want to see if anyone's even hearing me. So, well, we appreciate those in the buffet line keeping it quiet. Okay, thanks. Again, welcome to the Rotary Club. We want to start the invocation with Jack Wilson, followed by the national anthem played by Wesley Gentle.
Good morning, everybody. Please join me in prayer. God, we gather here today with grateful hearts. We are thankful for this city of Fort Worth, for the neighbors who make it strong, and for the privilege of serving a community where we are proud to call home. Thank you for bringing together people of different backgrounds, professions, and perspectives, united by a desire to place service above self. Guide our words and actions so they are truthful, fair, and beneficial to all. Help us build goodwill, deepen friendships, and recognize opportunities to lift others. May we be grateful not only for what we have, but for what we are able to give. Bless the work of this club, strengthen our commitment to one another, and let our service leave Fort Worth better than we found it. Amen. Amen.
There's not much clapping there, but I must say I had to pause my own singing just for a moment because it really, really sounded good. So thanks very much. And those of you in the buffet line back there, don't forget to keep the noise to a minimum so the rest of us can hear what we're doing up front. That's great. Thank you. Okay. Now I'd like to welcome Gina Scholl to welcome our guests and visiting Rotarians. Gina.
Good afternoon. We have a wonderful group of guests here with us today, including former Rotarians. We do hope that you consider joining us with a membership and join this incredible group of people. If you are a guest today and I call your name, will you please stand so we can recognize you? April Williams, guest of Jim Austin. Thank you, April. Dr. Razik Badmosi, guest of Rebecca Montgomery. Michael Lemon, guest of Rachel Tate. Valerie Salter, guest of Michelle Krim. Blake Kretz, guest of Tran Trong. Thank you. We have several guests of Barclay Burden, Ajith Pai, Tracy Martinez, and Debbie Phillips. We have several guests of Mike Herman, Joshua Green, Jolie Panad, and Brittany Franzen. We also have Paul Latheme from Broad Nowlin, and Lee Hecker from Ed McGlynn. Carter Sneed from Mickey McBride, Thank you, Carter. Trasha Kovin from Perry Pillow. We have Laura Perez from Bren Robertson. Pratasha Mangatri from which is a former Rotarian from Pennsylvania. We hope you consider us for membership. And this is a guest of Aurora. Thank you, Aurora. We have Gabriel Garcia, a guest of Aaron Eastman. And we have two final guests from Ben Robertson, Grace Lewis and Megan Johnson. Thank you so much.
Thanks very much, Gina. Now, Grace, I know you're out there somewhere. Yes, you are. And you've been hanging around here for 2 months now or more. You're almost there.
I just submitted my check to Aurora, so very soon.
Well, I wasn't going to say that, but I do know that, so that's good. Thank you very much. So she's almost in. I'd like to take a moment to thank our program sponsor, Texas Health Resources, and we're glad to have a lot of guests here. Texas Health Resources is one of the largest nonprofit faith-based health systems in the U.S. and the market leader in North Texas. There are 30,000 employees and 6,400 physicians with an active staff, privileges, support, more than 420 points of access across 16 counties, home to 8 million residents. Their mission, to improve the health of the people in the communities they serve. So again, thank you very much for sponsoring today's program. Now let's recite the four-way test. Let's see how we do this. We don't need that, do we? Is it the truth? Okay, now you thought he only played the piano at the back of the room, or he'd be over there eating bread pudding or something like that. But the man right here, Wesley Gentle, with our newscast. Wesley?
Wow, well, what an introduction. Thank you all, thank you. Thank you, President Tom. You really all have made me feel just about as welcome as a podcaster at the Tarrant County Commissioners Court. Yeah. There we are. Yeah. That's my only joke for today. Thank you very much. Okay, there we are. Speaking of Tarrant County, there we are. Tarrant County College is facing a significant challenge to their budget as they set it for their upcoming year. First, they were told by the governor that they cannot raise their tuition nor fees. Then they were told by the state that they're going to receive less funding than they were expecting. And just to tie that knot a little bit tighter, the Tarrant Appraisal District made their nefarious property value assessment freeze, which has resulted in a dramatically lower projected revenue, not only for these public entities managing our junior college, but also our independent school district and literally everything that keeps our city functioning. When asked how TCC will continue to provide an annual economic impact of $2.3 billion to our community, directly support 27,929 regional jobs, provide dual credit pathways for high school students, and of course support workers and local businesses alike with upskilling and certifications, trustees, including Trustee Veronica Chavez Law, have suggested that the board may need to raise their tax rates, which, after adjusting for TCC's homestead exemption, let me see here, yeah, that should set the average Fort Worth taxpayer back an additional $23 a year. How dare they, said one local resident, as they guzzled down their second $12 matcha latte of the day. Oh, that's good. I was worried if that joke didn't land, I was going to suggest you can take one of TCC's personal finance classes, which are enrolling now. $74 for an entire semester. Speaking of Tarrant County, again, let's go 3 for 3, I think. Tarrant County's Transit Authority, Trinity Metro, made the news over 3,000 times, which they made the news in the right way, let's clarify, in the best way, during this summer's large international soccer competition. Of course, about 9% of that FIFA World Cup took place right here at Dallas Stadium in Arlington, Texas. Yeah, why not? One of the biggest stories to come out of this very sweaty 2-month football extravaganza concerned one of the biggest gas stations in the world. That's right, Buc-ee's. And someone at Trinity Metro is absolutely getting a raise after dedicating a bus route that transported fans who had traveled from all across the world to see a gas station run by the same company that holds the world's record for the largest car wash. But that's not all. Yeah, let's clap for Buc-ee's, everybody. No, let's clap for Trinity Metro. That was a really smart move. Oh gosh, here I am off my script again. But that's not all. Because Buc-ee's is also well on its way to setting another world record, can you believe it? After opening their 27th federal trademark infringement case. That's right, this time suing Mickey. No, not that Mickey. The all-powerful purveyor of beaver nuggets is going after Mickey's Mart in Ohio. And for those unfamiliar, this is Mickey's logo, a moose. The moose is not wearing a hat, but let's see. According to the claim, the moose is smiling, sort of, looking to the right, kind of, and it is a cartoon animal, right? Well, watch out, Mickey. That's great, isn't it? The 1970s bellwether shopping center, Ridgemar Mall, is now on track to become a Class A business park, which will pair nicely with the neighboring headquarters for Texas Ballet Theater, which reopened this summer after a multi-million-dollar renovation, and which is, in this newscaster's humble opinion, very classy. Yeah. In entertainment news, 2 weekends ago, a superhero movie about a human with spider-like abilities, which stars Tom Holland and Zendaya, pictured here, dethroned a Christopher Nolan blockbuster, The Odyssey, which also stars Tom Holland and Zendaya, pictured here. So Tom Holland and Zendaya were bumped from the #1 box office spot into the #1 box office spot by Tom Holland and Zendaya, but nevertheless, The Odyssey is still reportedly saving movie theaters from multiple years of declining sales. And that's thanks in large part to this Trojan horse-style popcorn holder. Yes, just like Matt Damon, moviegoers can tactfully infiltrate the darkened halls, carrying a few brave colonels in these iconic and overpriced vessels. But speaking of expensive war games, yes, I'm so sorry. Good Rotarians and distinguished guests, I do need to interrupt our regularly scheduled newscast to inform you that the following section is not suitable for all audiences. It contains spoilers for a 3,000-year-old epic poem. Maybe worse of all, it debases the glorious music of Amadeus Mozart. And it contains a subtle insinuation that the United States of America should not start forever wars that cost taxpayers more in 6 months than we could spend in comprehensive healthcare programs for an entire year. Shout out Texas Health Resources. But before you start drafting that angry email to President Tom, and I can already see you doing it, trust me, please know that you have been advised and that the Rotary Club of Fort Worth is only partially liable for this. Nolan's film, Greece at war with the Trojans. 10 years past, peace at last, bring that horse in. Odie's men steal the win in ceasefire, and Agamemnon sails home to his wife. But the queen and her lover conspired, and Agamemnon ends up on a knife. In 2014, Russians took Crimea. In 22, Putin tried for Kiev. 3 days in May, we thought we held peace talks. As of August, no peace has been made. As of August, no peace, I'm afraid. February of this year, Israel and USA both bombed Iran. And in Hormuz, oil cruisers got fenced in. American summer plans got expensive. In Geneva, we called for ceasefire, and in a fortnight, the fighting begins. Deep in Jordan, they pray for ceasefire, and markets fall and then rise once again. First invasion, cue the Back in June, Rotarians gathered in Taipei for talks of peace. Malala, new President Inca, and 38,000 attendees, 140 different countries. Every faith and way of thinking calls to turn hope into action and to create lasting change. Good Rotarians, I now ask you, how will you invest in peace? My dear friends, I'm here to ask you, how will you make violence cease? How will you make hope increase? How will we make lasting peace? And finally, weather this weekend will be hot. But you can hang out with the cool kids this Saturday evening in the shade at Birdie's. You'll find free live music all night at Amplify 817, presented by your Fort Worth Public Library. However you choose to spend the weekend, be well and do good. Thank you, Tom. Appreciate that.
I'm not sure what just happened here just now, but there was a lot more news there than we usually get, and we all actually were paying attention, so that's good. Who needs the Rotary newscast? Wesley, every time you do something, it is so beautifully done. Thank you so much. I mean, that was a lot of work on the screen and everything. And singing's a natural thing for you, so not a big deal, but anyway. Thanks very, very much. We appreciate it. Okay, now we want to have two first readings with Secretary Brenda Matamoros Beveridge. Go right ahead.
This to me just feels so, I mean, I'm so lame compared to Wesley. So, good. But dance, that's later. We have two first readings today. The proposed members are Cody Palmer. He's the CEO of BCV of Texas, and his proposer is Drew Carlton. The second name is Russell Byron Webb. He's the owner and CEO of Silver Oak Commercial, and his proposer is President Tom Law Jr. If no written objections are received in the Rotary office by August 21st, these proposals will be given a second reading and voted on by the club. Thank you.
Thanks, Brenda. Now it's my pleasure to introduce our chairperson of the day, past President Gary Cumby, who will introduce our speaker. Gary?
If you're going to do that, please go get back in the food line. Our speaker is Barclay Burdan. I'm not going to do that. Well, by now you know that our speaker is Barclay Burdan, our very own club member. He's also the Chief Executive Officer of Texas Health Resources. And you've probably read the Rotograph article, which describes his successful career and all his many involvements in the community. Instead of reading that to you from the podium here, I'll just hit a couple of highlights and perhaps a couple of lowlights that were not included in that article. Barkley was born and raised in the Chicago area. Chicago has produced a lot of successful and famous people: Walt Disney, Harrison Ford, Robin Williams, also Al Capone, Frank Nitti, John Dillinger. Hoping to turn out more like that first group, Barkley left Chicago and came to Fort Worth to get his undergraduate degree at TCU. And there he became a thoroughly dedicated horned frog. In fact, recent blood drives at THR, our phlebotomists have verified that he does bleed purple. But for whatever reason, and perhaps it was that Chicago deep dish pizza, he chose to go back to Illinois to get his MBA, his Master of Business Administration, at the University of Chicago. And after a couple of early jobs in the healthcare field, he came to work for the Harris Methodist Hospital System. And that's where I got to know him 40 years ago. I served on the board of that system and on the board of its downtown hospital. And we were starting up a new venture to be called Harris Methodist Hospital Southwest. Barkley became our first employee there and its president. It's pretty easy to be president if you're the only employee, but he kept that job even after we started hiring people. We had early concerns about Barkley having gotten his business degree in Chicago. We know how they do business in Chicago, and we were a little concerned and wanted to make sure that our collection activities weren't too aggressive, but our concerns were unfounded. Barkley was as nice a guy then as he is today. Very compassionate, very patient-focused. In fact, here's one example of his patient-centered innovations. He's the guy who came up with the idea of a new kind of recovery room. It's located right after you leave the cashier's office. Barkley was very successful heading southwest, and he put it on its path to becoming the stellar facility that it is today. And while he was there, he began getting involved in the community, among other things, including the Rotary Club of Fort Worth South, and he became its president. His success at the Southwest Hospital made him the perfect candidate when the downtown hospital needed a new president, and he provided great leadership there as well. He also increased his presence in the community, providing top leadership for a long list of wonderful community organizations, the United Way, the Heart Association, Fort Worth Sister Cities, and many others. And in 2004, I was proud to sponsor him as he joined this club. And when the Harris system merged into what became Texas Health Resources, he was a natural to fit as the number 2 behind his CEO, Doug Hawthorne. And when Doug retired in 2014, Barkley took over the CEO role, which he has held to this day. Now, as he approaches the end of his career, he'll be assuming the role that I have considered to be my second favorite job in the universe: retirement. He already has my favorite job, grandfather. Barkley and his lovely bride of 44 years, Marcia, have 2 children, Kathleen and Teddy, but they have 3 grandchildren, Decker, Marshall, and Madeline. Now, Barkley, as you enter retirement, you'll need a new wardrobe. And having lots of experience in retirement, I'm going to volunteer to be your fashion consultant. So I have a starter kit for you right here. I hope you wear it with pride, Barkley. It may be a little large, but I promise you in retirement you'll grow into it. And now, before I sew up the award for He Thought He Was the Program, I'm going to quit talking and let Barclay begin. Barclay, please help me welcome him.
Thank you, Gary. We will be matching for sure. And it's a pleasure to be here at the Rotary Club of Fort Worth. Been a Rotarian for a long time, not as active recently as I would like to be, but retirement gives me the opportunity to become more active. I thought what I would do today would be spend a little time talking to you about Texas Health Resources, commenting a little bit on the landscape, I think, of healthcare. Within the industry, we feel a little bit under fire right now, as many institutions do. And, you know, I think it's, when you think about hospitals and doctors, most people don't want to go there. You hope you don't end up in a hospital or in a doctor's office. And so I think the average person doesn't spend much time thinking about the health system and all the different pieces of the health system until you need it. Sometimes you need it in an emergency. Sometimes you need it as you get a little older and some things start working a little less well. But many times we don't really go home and, you know, sit around the dinner table at the average household and start talking about the hospitals and the doctors. So one of the things I want to do today is to give you a sense of Texas Health Resources and kind of some things that we do and some of the things that we face. You know, one of the things that's a real positive, I think, for the most part, overwhelmingly in the balance of good and bad, is that we are in a really a fantastic region to do business in general, but also to provide healthcare services. We got a strong economy, a good, really good job market. As has been pointed out before, we're continuing to grow. What we consider our service area, about 16 counties around the DFW area, now has, depending upon who you want to talk to, 8.5, 8.6 million people, continuing to grow. And at some point in the next couple of years, people expect that will continue and that we will become the second largest MSMA in the country, surpassing Chicago. It's a place where we have a lot of employer-sponsored healthcare services. Many large employers who are self-insured, like Texas Health Resources. We are just like many large companies. We self-insure and provide insurance to our employees in coverage. It's an interesting market to be operating in. And if you look at the kind of the middle of the market, the fastest growing area segment is the Medicare population, people 65 and over. And that's continuing to show rapid growth as the baby boomers that I'm in the middle of that generation of continue to age into what we say Medicare. The other thing that's kind of unique about this market is that Texas is on a list that we don't want to be on, I don't think, which is a list of the highest uninsured populations in the country. In fact, Texas ranks last in terms of the percentage of people who do not have health insurance. Right now, that runs 17, 18%, depending upon where you are. We are expecting, actually, that will probably go to about 20%, so about 1 in 5 people who might seek services at a physician office or a hospital do not have any form of insurance coverage, and that produces some behaviors that actually increase healthcare costs for all of us. Texas Health has continued to grow in this marketplace. I think has been mentioned, we have about 30,000 employees, so we're one of the larger employers in North Texas. I don't consider us to be a hospital system. When I took over as CEO, I started talking about being a healthcare system instead of a hospital system. Obviously, the most visible component of our system is the hospitals. They're the most capital intensive and the largest segment of our employees work in hospitals. But we provide access through many other channels. About 420 or so different ways for you to connect with Texas Health. And that could be through a physician in our Texas Health Physician Group, could be in one of our Breeze Urgent Care Centers, could be virtually through our urgent care centers or through behavioral health services. And you can do that basically through your phone, through your computer, or through your telephones, your laptops, virtually any way that you want to, you can interact with us. Most recently, we've entered into a venture with a company called PT Solutions. Right now, most of the physical therapy and other therapy services we provide are in our hospitals. They're not necessarily the best place to go from an access point of view in terms of parking and those kinds of things. So we want to redistribute kind of where we provide those therapy services. And we joint ventured with a company called PT Solutions that will work with us to expand retail-like physical therapy services all across North Texas. We have about 35 or so ambulatory surgery centers, about the same number of imaging centers, which are all ambulatory in nature and generally tend to be a little lower cost than the services that you receive in a hospital. A few weeks ago, we announced a significant expansion at our largest hospital in the system, Texas Health Fort Worth. We have been working on expanding the bed capacity there to try and relieve some of the pressure on the emergency room. And in fact, this week, a couple of weeks early, opened 2 new floors in the Justin Tower that added 70 some odd beds to the Justin Tower. The announcement really talked about the addition of some more floors onto the Justin Tower that will add space for our new Women and Infants Center, expanding maternity care and patient capacity and neonatal services. Texas Health Fort Worth is our largest hospital in the system and one of the region's, I think, most trusted hospitals. We're a level 1 trauma center. In fact, from a busy point of view, we are the busiest level 1 trauma center in North Texas. So we're busier than Parkland, busier than JPS, busier than the Medical City level 1 trauma center. And last week or so, that's gotten a little bit busier as JPS has been challenged with some network issues and had to divert patients away from their facility. We're known for a number of things. One of the things is that we see more stroke patients at Texas Health Fort Worth than any other hospital in the state. We have advanced certifications for care of stroke and cardiac care, and we really provide some of the region's most advanced care. You might not know it, but we've also added a burn unit recently, and we'll be expanding that burn unit and the resources required to care for burn patients in the coming year. We're also adding a new tower and renovating Texas Health Southwest Fort Worth. Ajith Pai is here. Ajith, raise your hand again. I didn't see where you were. Right there. Okay, got you. Ajith's a wonderful president of the hospital and is doing great things out there. As the communities around Benbrook and Crowley and Aledo and Granbury have grown by leaps and bounds since we first opened the doors of Texas Health Southwest. And as Gary pointed out, I was the first employee. In fact, I interviewed the first 100 people that we hired when we opened. And let me jump back, because another, I think, really fantastic feat that you might not, if you just read general news, you would say that there are some real workforce challenges in healthcare. In order to open those 2 floors early this week, in the Justin Tower, we had to staff those 2 floors. And the folks at Texas Health Fort Worth, in a matter of basically a month, were able to recruit about 75, what was it, Debbie, about 75, 77 RNs? Yep. Who were able to, because we can build it, but we can't run it if we can't staff it. So I was very impressed with the fact that they really buckled down and were able to recruit nurses to come work for us and help us relieve that pressure. We have a lot of other things going on across North Texas because we are a regional system. Although I always point out, we are based in Tarrant County. I'm supposed to applaud at that. In fact, we're the only local health system that's based in Tarrant County. We have a new 8-story tower going up at Texas Health Plano. We have OR renovations and expansions going on at Texas Health Hughley. We have construction underway in Forney, where we're building a new hospital. It'll be the city's first acute care hospital. That area is the fastest growing in the region, in the country, really. And we have plans to announce that we've announced a new hospital we're going to build in McKinney, as well as plans to build a new hospital in Willow Park. And so we have a lot going on. While new hospital announcements really get the most attention, it's really kind of the culmination of a long and measured approach to how we serve this growing market that we have here. Let me talk a little bit about that. Because we've studied where the growth is going to happen in North Texas, and about 95% of the growth is going to happen basically in the suburban areas, in an arc that kind of runs from east of Dallas, across the top of Collin and Denton counties, and then down into Parker County and southwest Tarrant County. We study the development of those areas. We look at the North Central Texas Council of Governments materials. We look at where roads are planned, where infrastructure is planned, where housing units are planned. And for those areas that are growing so rapidly that don't have any healthcare services, we start off by using Texas Health Physician Group and Breeze urgent care centers. So we'll locate those kinds of ambulatory facilities in a community that's in the early stages of growth. Next might come an ambulatory surgery center, an imaging center with our partnerships in those 2 areas. Or we might put a health and wellness center, a neighborhood health and wellness center in place. We have one of those in Burleson. It's been there for quite a while. We have one in Willow Park, and this is exactly what's going on in Willow Park. We added in the last year or two a surgery center out there, and then when the population gets to a point where we're ready to begin serving with a hospital, we begin to plan to put a hospital in. The health and wellness centers usually have ERs, so we bump up the ability to serve the patient population beyond urgent care to emergency services. And then we add more imaging and physical therapy and laboratory services. So, over time, as the growth happens, we make a decision to ultimately add a hospital. In Willow Park, the hospital's initial focus is going to be on complex joint surgeries, but is designed to really support the expansion of the community as it grows and is expected to open in 2028. Whether care is delivered in person or whether we do it virtually, we're committed to providing the same exceptional care at all the locations that we serve. In May, we reached a milestone, a major milestone, with every eligible hospital earning a 4 or 5-star rating from the Centers for Medicare and Medicaid Services, which really recognizes top performance for quality, safety, and patient experience. We're very proud of that. We actually have the most 4 and 5-star rated hospitals in North Texas of any system. And while the hospitals themselves receive the rating, they really reflect the care and the coordination patients receive across those care venues from everybody who delivers the services in those hospitals. In addition, 6 of our hospitals earned an A this spring from the Leapfrog Hospital Safety grade, and that's the highest possible rating you can get from them. They recognize excellence in protecting patients from preventable harm and from medical errors. So we're just as proud of that and are working our way towards having every single one of our hospitals get an A. So for patients and communities, these ratings, I think, indicate that Texas Health is focused on providing safe, reliable, patient-centered care. And for our care teams, the achievement really reflects the clinical excellence, the teamwork, and the accountability they bring to their work every day. And that's really important, as I've mentioned, because healthcare is a people business. It's people providing services to people. We're not yet at a point where it's computers providing services to people. And that's really why it's so important for us to foster a culture in the organization where employees can really feel comfortable doing their life's best work. Lately, I've been asked, what am I most proud of at Texas Health? And my answer is always our culture. Our people are the heart of our organization. They're the people that care for you and for me and for each other. And in turn, we really create a workplace and an environment that makes sure that we care for them as well. So as I mentioned, while you see a lot about workforce shortages in healthcare, and those do exist, they are real, we're fortunate that that's not an issue at Texas Health. We've surpassed that 30,000 mark of employees in June. We have very high employee engagement. We measure engagement regularly during the course of a year through surveys. We actually choose a benchmark that compares us to all industry, not just the healthcare industry. And we're in the top decile in terms of employee engagement. That gives us very high employee retention, also in the top decile, and very low average vacancy rates. And I think that demonstrates our commitment to creating a really supportive and engaging environment. We have been nationally recognized for our workplace culture. And in April, we were named to Fortune's 100 Best Companies to Work For list for the 12th consecutive year. And you know, the important thing there is that, because there are a lot of award things out there, the important thing about this particular award is it's based on what our employees say. We do fill out some paperwork and send it in, but 3/4 of the weight of the score it was provided by our employees. We give employee emails to a third party, and they go ask our employees what they think, and they know that we're not asking them. Another way that we care for our people is by providing a variety of benefits, and those cost us more every year, just like they are costing all of you every year in your businesses or in your homes. So let me touch a little bit on healthcare costs. Because along with quality and access, we have to consider affordability in healthcare. And that's the hard part right now. If you look at kind of our payer source mix, which is what we look at, where do our patients come from in terms of financing? I've already commented on the charity care piece. We have about 8% of our patients who have come through with individual market coverage in the past, or are military veterans. About 17% are Medicaid patients, and about 11% are Medicare patients. And you might find that to be a little bit interesting. Our country, actually the Medicaid program as a whole is more expensive overall than the Medicare program right now. And one of the things the federal government is currently trying to do pretty dramatically in policy is pull back on that expense in Medicaid. And a little less than half are covered through their employer in some way, shape, or form. Our challenge with the government is that they don't pay the cost of care. So Medicaid reimburses hospitals about 72% of our costs, and on inpatient care, and about 75% of our costs on outpatient care. And Medicare falls short of hospital costs, covers about 83 cents for every dollar of costs that we have. So we have to make that up somewhere. So we have Medicare and Medicaid not paying the full cost of care. And we have 17 going to 20%, 1 in 5 patients who can't pay for care, period. And what that does is it really pushes the burden onto employers, because employer-sponsored health insurance is the only other place that we can negotiate for payment. Now, let me disabuse you of a common understanding that some segments of the healthcare industry or its critics like to repeat quite a bit, and that's that hospitals are responsible for the overall increase in the cost of healthcare. 2 points. One is when you see your costs going up, so your premium costs, your insurance costs, going up 17%, 15%, 16%, I can guarantee you that the percentage cost increase that we've negotiated with the payers is a fraction of that, a small fraction of that. So we're always kind of scratching our heads in terms of how that translates from what we see our increases coming from those payers to what the premiums are increasing. The other thing I would say is that you have to think about hospitals. We're put in a position of being cost aggregators. So the cost of medical devices, the implants that go in your hips and your knees, and the cardiac implants that, that people get, the stents, all those kinds of things, developed by third-party for-profit companies, that we pay the bill for that. They send us the bill, we order them, we pay for it. So we're just aggregating the costs that come through the system. It shows up in the hospital bill. Now, I'm not advocating that everybody should send you a bill already. You get an anesthesia bill, a pathology bill, a radiology bill in many cases. But I think it's worth thinking about the fact that, pharmacy, medical devices, all those things are embedded in the costs that show up on our hospital bill. And we're not seeing the kind of increases that are purported to be out there in the marketplace. The real challenge is when people can't afford to consume the health care at the appropriate time, whether that's going to the doctor or fulfilling a prescription, or going for a scheduled case into a hospital, they just delay things until they get worse. And that postpones expense because it ultimately always comes back. We'd much rather see people taken care of early in the process than late. We'd much rather screen more people and identify problems early than wait till they show up in the ER. But a lot of that happens. So a primary driver of healthcare costs is, coming from these places and from the risk factors of lifestyle, including treating chronic diseases. About 90% of the nation's almost $5 trillion healthcare bill goes toward chronic and mental health conditions, many of which are preventable with more access to early intervention and community health resources. And I would say recently at a conference, we heard some folks who are talking with CMS in Washington about the healthcare system and how do we fix things, comment on the fact that the administrative costs in healthcare are about $1 trillion a year. That would put the administrative costs somewhere in the top 25 economies of the world. That's not the healthcare delivered. That's all stuff that surrounds the healthcare. It's insurance billing. It's fighting the insurance payers. It's doing all those kinds of things, which really doesn't provide any value to patients. That's what we have to redesign out of the system to make it simpler and make it work for people. Because we have to provide more care directly to people. So when you look at that trends, I think it becomes clear that we can't really treat our way out of these challenges. We have to really think beyond treating illness, focusing more on keeping people healthy. Health is really shaped much more by what we choose to do than what happens in a physician's office or in a hospital. So we all have an individual responsibility there too. Every 3 years, we conduct a community health needs assessment. Recently, that indicated food, isolation, and transportation were among the major barriers to well-being. Mental health and chronic disease outcomes are worsening in multiple regions. So we use those findings to really guide efforts under a part of Texas Health that we call Texas Health Community Hope, a broad range of innovative programs and strategic investments and community collaborations really aimed at improving the health of North Texans. I was talking to Gary before we came up here, and Gary was talking about one of the food banks that he works at Texas Wesleyan, and the delivery of nutritious food that THR provides through others on a weekly basis there. In fact, last year we distributed just shy of 1 million pounds of food throughout North Texas. And I really think it's true that if North Texas wants to continue attracting employers, jobs, and talent, part of making the state business friendly is to think about health the same way that we think about infrastructure, same way that we think about education. And thankfully, one thing North Texas does particularly well, I think, is partnerships. So business leaders, schools, nonprofits, faith organizations, many of you in here have a long history of coming together to solve problems, create opportunities. Another thing that Gary recalled with me was when we brought Blue Zones to Fort Worth some years ago in an effort to create a safer and a healthier environment that would help nudge people to make better decisions. So that's really one of the reasons I'm really optimistic about the future of our region. And so now, before I open it up for questions, I want to come back to our upcoming leadership change. As you all, I think, now are fully aware, I'm going to step down as CEO in September, shortly after my 40th service anniversary. Leading the system for the past 12 years and being a part of THR for the past 40 years has really been the honor of a lifetime for me. Winji Mayo, who's here today, is going to succeed me and become Texas Health's third CEO. I think many of you already know Winji. Come on up here, Winji. Winji is an exceptional leader, and I'm delighted that as the board went through the succession planning process that they ended up choosing Winji as the next CEO. She's going to be great. She's wickedly smart, a whole lot smarter than me. And while THR's trajectory has been up, she's going to increase the rate of change at the organization. So I asked Winji to join me for the Q&A session. One of the things I get to do in the last month or two is give her all the hard questions. So why don't we open it up and see if you have any questions? Yeah.
Speaking of, speaking of technology, specifically AI or artificial intelligence, what are y'all at Texas Health currently doing today using artificial intelligence? Where do you see that in 12 months? And this may be hard to predict considering the rapidly changing nature of the technology, but 5 years from now, where do you foresee that?
We use AI now in a number of cases very effectively, I think. We are just completing a plan that really will guide us in terms of investment in technology and prioritization and how to frame the discussion because there's so much out there. And I'll let Winji give a little more detail on that.
Sure.
Thanks for the question, very relevant one, and a great one. You know, when we think about utilizing technology, we want to be a leader, but not, we want to be on the leading edge, but not necessarily the bleeding edge, right? No pun intended. There are certain areas that you're okay to try out AI. For example, recently I built my own AI travel agent, which is kind of fun if you've not done that. But you probably don't want to try out a new agent with somebody, you know, advising you on your chronic diseases or where to go, or perhaps doing surgery on you. And so we think about AI really in three ways. One, on the administrative side, you know, Barclay talked about the $1 trillion. Think about that for a minute. $1 trillion in administrative costs. There's a lot of that can be automated and can be far less frustrating for both you and I when we interact with the system. The second area is in what we call consumer-facing care. So scheduling an appointment. You know, you book your airline tickets online and you can do it within 30 seconds. You should be able to do the same thing when you're booking an appointment with us. So there's that consumer-facing lens. And then really on the clinical AI side, where for us the philosophy is there should always be a human in the loop. It is AI enabled, but you always want that expertise at your fingertips, and it's enabling those experts to be able to do their job. So we're excited about things like ambient listening, which we've had in our clinics for 5+ years now. We're excited about things like virtual nursing, which we just launched in our innovation units, one of which is at a GEAS hospital at Southwest. And a lot of things that are on the horizon because we're just getting started.
You're getting the hook. Thanks, Tom.
Come right on here. Let me tell you, it's a tradition of our club to make a gift in your honor for speaking today to the Rotary Plus, International Plus Fund. And we really appreciate you being here. And please, if you wouldn't mind staying around for a little bit for some other questions that people might have after the meeting, we'd appreciate it so much.
Thank you.
Very informative, very informative. So you all please do so afterwards. We do appreciate it. I do have a couple of announcements. First of all, next week we're going to welcome Miguel Calera, Director of Retail Marketing of La Grande Plaza, giving us an Hispanic Economic Impact and Heritage Update. Also, next week, first of all, you may have seen these on your table. This is from the 4th ISD, and we've been asked to participate in a listening session next week, which we're going to have afterwards. If you would, go ahead and scan this. There's only 5 questions on it. If you like, fill out what those are. They'd really appreciate it. And again, after our meeting next Friday, we'll continue, adjourn the meeting, and then continue with a listening session with some of our 4th ISD board of managers and also Rotarians as well. So please stay to participate in that next week. Oh, meeting adjourned. Okay, thank you very much.